and welcome back to the Gut Health Dialogues. I am here with one of my wonderful patients, Doug, and he's here today to share his story because he's one of those who was, like many listeners, struggling for a long time with mysterious symptoms. And today he's feeling a lot better. And this is one of those cases where I think a lot of people might be able to relate. So welcome, Doug.
Thank you.
All right. Well, we've been working together for how long now? Maybe 5 or 6 months,
Yeah, it sounds about right. Yeah, 5 or 6.
something like that. And it's been a journey, hasn't it?
To say the least. Yeah, for sure.
But you've come a long way. So I would love for you to maybe start by telling the listeners how you were doing 6 months ago and what you had been through up until that point on this health journey.
Yeah, so 6 months ago, I was at a point probably a lot of people are at where your diet is so limited, you feel bad all the time. I was tired a lot. At the time, I'd been dealing with just kind of general IBS. That was the diagnosis that I received for about 2 years. And over the course of 2 years, I tried a lot of different things, limiting my diet. I did the FODMAP diet. I was taking some tricyclic antidepressants to help out with the brain gut axis, which I found out later on was really mostly just because of the side effects related to the constipating factors of it, which kind of helped in a way because I was dealing with a lot of loose stools and things like that, a lot of irregular bowel movements. So in some degrees it helps. I was also doing like acupuncture and meditation and different things to try to really get over some of that mental components of IBS. But I was still stuck. I was still just really stuck. And I felt like I just kept whittling down my foods until it was basically just like rice and chicken, maybe a little bit of cheese here and there. But I ended up finding you online. I was just looking for different recipes. It's like, how many ways can I cook rice and chicken? And I ended up finding a recipe that you had for rebuilding the gut, the veggie mash, like having 30 different kinds of ingredients in a small package it's been cooked, it's been processed. And I thought that seems like a really smart thing to do because like I'd hoped to start bringing in some different foods into my diet since I had whittled it down to essentially nothing. It's like, okay, I got to build up from here. And then as I was doing some more digging, I found some of your podcasts and I listened to some of your conversations with people. And I thought, she sounds like she really knows what she's talking about, particularly when you started to get into the details of IBS and SIBO and all of the other causes, which at that point, I'd gone to 2 different general practitioners, 2 different GI specialists. SIBO came up once and it was generally dismissed. And I just wasn't getting a lot of answers. And it just seemed like I was really stuck. And I thought, okay, I'm going to try just more of a dietary method. And it seemed like you were bringing in different types of supplements and different things that would remove some of the bad bacteria, build up some of the good. But I just took the chance. I'm like, okay, I don't know what else to do. I've tried so many things, most of which weren't covered by insurance. I didn't have great insurance. And so like a lot of those GI specialty appointments were out of pocket, $350 a shot. When I was just like, wow, I'm getting nothing out of this other than another prescription. So when I found your information, then I was just like, oh man, I got to give this a shot, see where it goes. If nothing else, I'll just check another thing off the list and move on to whatever happens to be next.
Yeah, yeah, I think a lot of people can relate who have IBS because there's really just with standard medicine, there aren't a lot of great answers other than just managing your symptoms. But most people want to know, why is this happening and what can I do to fix it and live better? Because you're not even managing your symptoms. So you mentioned you were taking a prescription, right? But you were still miserable.
Yeah. Yeah. And one of the things that was so difficult is like, obviously, when you have very regular bowel movements, you're constrained to the house. You don't go out a lot because it's like, okay, what can I do? I don't want to be too far from a bathroom. But I also just felt like tired all the time. Like I knew I was not getting enough nutrition. And so that's why I was thinking in terms of like, okay, again, I've stripped it down to nothing. Like, how can I systematically build this back up? And compared to everything that I had been hearing from the clinicians that I had been talking to, it seemed like the most logical thing. Like, okay, let's start with the safe zone and just slowly build on top of it. But that is so overwhelming to think about, like, I'm going to manage my own diet rebuild, and I'm not much of a cook. I'm a person I've got a few foods that I like, and I'll kind of just repeat those a lot over the course of a week. And it was very intimidating to me to start looking at diet and trying to systematically rebuild it. And so, again, hence I reached out to you. And then the first thing that we did was do a lot deeper testing than what was offered. Like the fecal testing went into so much more detail than anything else that I had experienced. The fact that you just said, yes, do the SIBO test. Let's find out what's happening. And then, of course, it comes back positive with that hydrogen sulfide SIBO. And then when I started going down that path and like reading what was going on, I was like, oh my gosh, this is exactly what's happening to me. It is the gastric irregularity and the bowel stuff, but it was also that fatigue. It was the brain fog. It was joint pain. Like the joint pain that I had been feeling was really quite miserable. And I've always been a really active person, and not being able to do different activities because you're tired and you're sore. I was just like, this isn't a life. Like this sucks. This is not how I want to be on a daily basis.
Yeah, and play music too, right? You like to
Yeah,
play
yeah.
music, and your wrist, was it your wrist that was painful?
Yeah. I have tendonitis in my wrist, which is there, but like whenever my gut would flare, my wrist would get much worse. And I could feel this kind of systemic inflammation happening when my gut was off. And it was like my wrist would hurt and I wouldn't be able to play at all. And I was trying to get together with these guys and just form a little band and just play some dumb songs here and there. But like even just keeping up with the group was almost impossible because I would have to take like maybe a week off at a time and not being able to practice because everything hurt so much, and if I'd go try to go for a run or a hike or something like that, and then it's like, oh, now it's my toe that's hurting or my knee or my hip or my back. And it just always seemed to like coincide with what was happening with my gut. Something happens physically. I should maybe be a little sore, but I'd be like super sore and need to take a couple of rest days where I would never have to before.
Yeah, and that's because that we talk about this a lot, which is the inflammation that starts in the gut from the bacterial overgrowth, gets through the leaky gut into the bloodstream and travels all around the body, and it can cause joint pain, it can cause fatigue, brain fog, symptoms all over the body. And that's what it sounds like you were experiencing and what you were describing. And a lot of people don't think about going to a dietitian. I had another client, Trevor, who also recorded an episode, and he was like, his doctor had referred him to me, and his initial thought is like, I don't need a dietitian. I don't need someone to tell me how to eat healthy. This is not what this is about. And I think people don't realize that. They think maybe a dietitian is just going to tell them to eat the food pyramid, and if they just eat healthy, everything will be fine. But really, in functional nutrition, we're looking at restoring wellness. We're looking at natural therapies, whether it's food, lifestyle, certain supplements, to help actually restore the health and resilience of your gut so that you're not having these problems, or we're greatly reducing these problems. And you mentioned it's challenging. It's like a minefield when you think about going from chicken and rice to a healthy, balanced diet. You just can't get there from there. You can't make that jump. And so that's why we did the testing, because we had to first fix a lot of what was going on in the gut before you'd be ready for that point. And one of the reasons I wanted to have you tell your story is because you had the hydrogen sulfide overgrowth, and that is something that slips through the cracks so often. I mean, IBS is already challenging to treat, but hydrogen sulfide goes undetected. And maybe now they have a 3-gas breath test for SIBO now called the Trio Smart that I see a lot of the gastroenterologists in my area using, and that does test directly for hydrogen sulfide. I believe we found yours through just a standard hydrogen methane test, though, because when we see a flat line, and then that's indicative of hydrogen sulfide, meaning we don't see fermentation that's actually we know is happening in the large intestine, but it's the hydrogen gas is being eaten up. So we see that flatline presentation. And then when we compared it to, we saw the elevated disulfovibrio bacteria on your stool test. And then we have your symptom profile. And then we did low sulfur diet, right? And you felt better on that. So we kind of looked at the big picture and we were able to determine you had hydrogen sulfide. But that's one of the reasons it takes kind of someone who does this day in and day out, who's seen hydrogen sulfide. A lot of practitioners don't see it very much, or they don't know what to look for. And so it slips through the cracks. So I'm just always, in a way, kind of happy when we find it, because I know that we needed to find it and it needed to be addressed. Not happy that it happened to you by any means, but I'm glad that you're doing better. So can you tell us what kind of the journey was for you, just honestly, as far as undertaking this diet changes, going through the supplement protocol? I mean, what was that like for you as one of our clients?
Yeah. So I want to go back to, you had mentioned coming to a dietitian in the first place. I think I probably had some of the same similar thoughts as Trevor. And I was kind of like, I don't know really what I'm going to get into. But the first thing that really impressed me was the level of investigation. Like all of that testing and being able to go through, like, here's what we're finding and here's what some of that can mean, and making some assessments on that. And one of the first things that we found is you had noticed there were some levels that tended to correspond with gluten intolerance. And I had never in my life considered myself gluten intolerant. I've been eating bread and baked goods for years. And in fact, I thought it was a relatively safe food, generally speaking, because I usually didn't have diarrhea after that. But when you suggested, well, let's take this away for 2 weeks, I thought, well, I can not eat bread for 2 weeks. Not a big deal. But it was still one of those things where it's like, well, I don't think this is the problem. This can't be it. But like within like 3 days, I remember kind of having this point where I'm like, my gut feels funny. Something's going on. And I was like, oh, it's not bloated. Like the bloating that I had felt for so long was completely gone. I was like, this is different. This is strange. And I felt really good over the weekend. Obviously, like, I still had issues. We had the hydrogen sulfide SIBO, but taking that out of the equation really started to change things. And I was just like, ooh, there's a lot going on here that's super complex. And removing that, like, I don't know, it was almost like having like a big filter on my experience. It always went through this filter of extreme bloating and gassiness. And now taking that away, I could really start to pinpoint, like, ooh, now I am noticing like I had that high sulfur food. I am having some loose stools after that. I'm feeling tired specifically after those. And then going through that, then it got into this component of, then it's on me. Like, okay, we figured out what it can possibly be, but then I have to live it. Like, I've got to put up a different protocol for myself. Like, okay, I had a little med sheet. I'd sign off whenever I took the supplements at their time. Because for a while there, it's a lot, like several different times a day, and charting all of my food. And I had been charting my food casually beforehand, but as I started charting it more, just being more mindful of it. And it's not exactly the funnest thing to do, to sit around and log everything you ate after your meal or during the meal. And it can be a bit much, but at the same time, like, as you start to go through it and you start noticing the patterns and you start feeling better. And that was the big thing. After we went through that first phase of like, okay, let's get rid of the gluten. Now we're looking at the hydrogen sulfide SIBO. You had given me a few recipes that were looking at, really trying to bring in some nutrients, like some smoothies and things like that. And I remember the first smoothie that I had was like, it was the most delicious thing I'd eaten in months. Like, not only did it taste really good, but it had all of these nutrients that my body was just craving. And within probably a week of having a smoothie every day, I was just like, I feel like physically better, like clearer, more energetic. And that's when I really started realizing, like, this is for real. Let's keep doing this. And so then it was like enough of a reward for me to keep going. It took a little bit to get there. Not that it was a super easy thing, because like about a month into it, I got sick with something or other, and a lot of my gastrointestinal system started coming back. And I got this point where I'm like, oh God, nothing's working. Am I going back to square one? And I just had to have a conversation with myself of like, I just said, I need to stay the course. Let's keep doing this. And I did. And as that illness passed, whatever it was, I started feeling a lot more stable, to the point of like opening up my diet more and like trying new foods. And I had a moment probably about, gosh, maybe 2.5 or 3 months into it. and I had to go to a conference in Baltimore, and I was really worried about it. I was like, oh my gosh, I'm not going to be able to control what I eat as much. I'm going to be in these sessions all day. I was really worried. I packed a lot of my own food, thinking, okay, I'm just going to skip all the meals and I'm going to go back to my room and I'm going to eat my gluten-free bagels and I'm going to have some oatmeal that I packed and stashed and granola bars that I knew were safe. And I ended up just like I would have a bagel and a granola bar of my own for breakfast. And then I was able to eat lunch that was there. I was able to find choices that worked with my diet that weren't too bad. Had one evening where I probably ate and drank things that I shouldn't. It was the fun evening. We had karaoke night and a lot of drinks involved and foods that probably would have done me really wrong previously. I ended up getting up the next day and just having some minor issues, but nothing that stopped me. Like I didn't miss a session. I didn't have to excuse myself or run to the bathroom at any point. And so I was able to get back on track and then start to feel confidence enough to like go to places and be like, you know what, I'm not going to have to worry so much. I can find something, I can eat something, I can feel decent and get through this. So being able to get through that for 4 days was just a huge step for me. And it just goes back to that needing to really commit for it's going to take a bit. It's going to be 3-4 months, 5 months, whatever it might be. But I look back on the last 2 years and how miserable it was. And it's like, why wouldn't I do that? And now I'm at a point I still feel like there's still a lot of journey to go to get the gut healed, but I'm able to enjoy a lot more meals. I feel a heck of a lot better. I'm able to bounce back a lot quicker. That's a really big thing. If I do eat something that's not agreeing with me and I have a relatively bad day, the severity is not nearly as bad. Then I'm usually done with it and I'm back on my way. And so seeing that kind of improvement over time, I think is really powerful, but also knowing that it's gonna take commitment and you got to get up every day and do it. Like,
Yeah.
but that's how you improve.
Yeah. And I really appreciate you explaining all that because this is not a quick fix. The gut is complex, these issues are complex. And the process you're talking about is the process that we go through where initially we made diet changes to calm symptoms down because due to the underlying issues, and by the way, your issues were the hydrogen sulfide overgrowth. You also have enzyme deficiency, which often happens secondary to the overgrowth. So the inflammation from SIBO can reduce your pancreatic enzyme output. And we did find that to be the case. Your pancreatic elastase was subpar on your stool analysis. Now, it was not low enough that a gastroenterologist would diagnose pancreatic insufficiency, but it was borderline. So again, that's another finding that would have been ignored or looked over if they had tested for it. But it's significant in this case where you're not digesting well, you're not tolerating foods. And then we found, yeah, the gluten issue and lots of inflammation. So we initially did the low sulfur, the gluten-free diet to calm down the symptoms. That takes a lot of effort on your part. A lot of people, though, feel they've already been trying to figure out what to eat. They've already been stressing about diet. So at least to have some clarity about what to focus on. Okay, I need to think about this, but I maybe don't need to worry about all this over here. Like you don't need to worry about low FODMAP if your symptoms are driven from hydrogen sulfide overgrowth because the low FODMAP is actually not appropriate for your type of IBS. So we were able to narrow down what you actually need to focus on. Okay, you can expand your diet safely, gradually in these areas. And then it's a process of clearing the overgrowth, which can take weeks to months, depending on the person and what they have. And I appreciate you sharing about the ups and downs because that's truly how the journeys go. Because during that period of time, there's going to be little stumbling points because we're not always perfect with the diet. So while you still have the overgrowth, you're still going to be sensitive to foods and little things can still set you off. And even though you've made progress, the symptoms feel the same when you trigger them. And so it can feel emotionally like, this is how I used to feel. I'm back to square one. When really you could be halfway there. You could be 3/4 of the way there. You're just having a temporary flare. And like you said, those signs of progress, those are pretty consistent across the board where we see that happening less often as we go through this process. The recovery is quicker. The symptoms are less severe when they're triggered, but it's not 100%, at least not at this phase. And then even after we're finished working together, I mean, at this point where we're at, you're through the protocol to clear the SIBO, and now you're rebuilding the gut and you're healing the gut. And that's a process too. Over the months, things get stronger and stronger. So, yeah. And then I think also with you building your immunity back, when you have this overgrowth, like you've shared with me that you just were sick with COVID. When you have this overgrowth, your immune system, it's fighting this overgrowth chronically for 2 years or however long you had it, and it gets worn out. So building that back is a process as well.
Yeah, that's huge. And one of the benefits from the process that I found was just having the awareness of food and how it makes you feel before you're just blindly going in the dark. It's this, it's that, it's maybe this other thing. I think it's the FODMAP stuff. You don't know. And as we've been able to build things back up, I'm starting to feel like, ooh, it was that, and I can tell and I can start to understand what's working, what's not working, really focus on those foods and those meals that I know are safe. So my safe zone is so much bigger than it was before and so much more healthy. We were trying to hit the 30 different plant foods a week. And now I feel like, yeah, I can do that without too much of a problem. And there's a lot of great stuff. And for the listeners, I can't describe how good it tastes. Some of the first foods that you've had after a long time. I tested some corn on the cob. Corn on the cob has not been my friend for the past few years. And I just had a plain piece of corn on the cob. No butter, no salt, no nothing. Just naked corn on the cob. And I swear to God, it was the best corn on the cob I've ever tasted in my life. And I had a half a cob and it worked. It was fine. I felt good. And getting to that point, like it took a long time, but boy, getting there, it was just like, oh my gosh, food is delicious again. I'm not afraid of it. And I appreciate different things out of it as I'm understanding. Like I've noticed as I've been building things back up that like heavily processed foods, not always that great, heavily fried foods. And so finding ways to cook and to choose meals that are cleaner, that are bringing out flavor without putting in different kinds of additives that not only are going to set my gut off, but aren't really that healthy in the first place. I think it makes it easier being healthy and to maintain because you not only build up the base of your tolerance, but you build up this base of choice, like which when you are so limited, like that's a prison in and of itself. Like this is the food you're going to eat for the rest of eternity because it's the only thing you can. Like that just limits so many life events. And to be able to open that up, I just think it's a huge gift. It's a huge gift that I'm like super thankful for.
Yeah, yeah. It's depressing, right? When you think that this is all I can eat, these other foods, I just don't tolerate them with no end in sight. And in fact, your list is getting shorter and shorter. It's depressing. So on the other end, yeah, very liberating when you realize, oh, okay, especially because the healthy foods are often the hardest to process when you're having gut issues. In fact, a lot of people try, okay, maybe if I just eat healthier, I'll feel better, and it can actually make them feel worse, which isn't fair, but that's how it can work. So you were down to chicken and rice. That's not a balanced, nutritious diet, but it's all you could tolerate. And you shared with us a little bit about what your gut health is like right now. Tell us about what's different in your daily life. Because I remember when we first met, you were working from home because of your company had you working from home, right? And then they were going to send you back to the office, and that made you nervous because at that time you needed the bathroom close and you didn't want to be that guy in the office, right?
Yeah. Yeah. And the first 3 weeks were hard. I was in the bathroom a lot and I found every possible route to the bathroom that I could take so it didn't look like I was just constantly going to the bathroom because it's embarrassing. It's like, okay, I'm going to go around this other hall and through this other place. So it looks like I may be visiting someone when I'm just going to the bathroom for the sixth time today. But now I'm just like a kind of a normal person. I mean, not 100% like I probably am in there more than most people, but at the same time, I'm still working through things. But like, I'm not having to like throw off my headset after a Teams call or something and rush to the bathroom. I was doing that at home. like just okay, I can get through this meeting and that's it, and then I gotta rush out or duck out of a meeting to go to the bathroom or something. And now I feel totally fine. I like coming in the office. It's a place I can see people, meet people, and it hasn't been an issue for the past month and a half or so, or whatever it's been, that I haven't had too many issues. So it's really been a huge change with that. And also the fatigue factor, just adding another thing to your day, going into the office, and I feel good. I come home and I'll work out and I'll be just fine. I go for a walk at lunch and I'm feeling just fine. So there's not only just that sense of I'm not a slave to the bathroom, but I also just feel good after doing something that has been out of my norm for a long time and having to redo all my routines and probably put out a little bit more energy. My energy level's still high, even when I talk to some of my coworkers who just talk about the stress of coming in makes them tired by the end of the day. So I feel very good about that.
That's huge. And honestly, the fatigue is one of the most challenging parts of these issues and one of the last things to start to get better. So it's a really good sign that you're already noticing that.
Yeah, that's a huge opener. And I went to a concert not too terribly long ago. It was an outdoor concert, standing the whole time. And I was like, oh my gosh, I'm still standing. I'm not tired. I could stand all night. It hadn't happened in a long time, because usually if I was in that kind of situation, my knees would be sore as hell. My back would be hurt and I'd want to sit down and just like want to go. And here I was just like, oh yeah, we can stay all night. Not an issue. So it really makes life so much easier.
Yeah, the things you take for granted but when you don't realize you
Seriously.
are, like the corn and just being able to be at a concert and being able to go to work, being able to work out after work. It's normal stuff. And one of the questions I ask people when I first speak to them is, what are your goals? And a lot of times their answer is like, just to be normal, really, like nothing spectacular, like just to get up, go to the bathroom once or twice, maybe one more time later in the day, go about my day, not have to worry about this, eat normally, not have to worry about this, right? It's not too much to ask.
Yeah, and it makes travel possible again, which is nice. And I've got a son in high school who's in like marching band and stuff, and I want to go enjoy that and be out on the street watching a parade for several hours and not have to worry about like, oh, am I going to make it until the band comes? Otherwise, I'm in trouble. And you arrange your life around your bathroom habits, unfortunately. And like I said, you just end up becoming a slave to it. And it's just, oh, I can't do this and I can't do that. And I'll just stay home here. So the freedom that it gives you. And one other thing that I just have to mention, I was just thinking about this, the freedom, like even before I had the the SIBO and the gastrointestinal issues, I'd had like a lot of acid reflux for many years. I just always had to have a Pepsid or a Zantac or something before I ate. And it was just so routine. After going through the protocol, I don't really need antacids anymore. I take them maybe once a week, which like that was another thing. I was like, okay, before I eat, I got to remember my pill and this, that, and the other thing. It even cleared up some things that I didn't really even consider a problem. I got to the point where I'm like, oh, you know what? I take some meds here and there, whatever. But knowing that I don't even need that, like at this point, like that's amazing. That was like an extra gift. It was cure your SIBO, and here's another free gift for your
Free
troubles.
gift. You have that acid problem even before, because this SIBO with you, the problems were really triggered. Do you mind me sharing when you had that melanoma, right? Did you have the GERD issues before that?
I did, yeah. I'd had the GERD for God, 15, 20 years maybe. It was just always a thing. And I know I didn't eat as well as I should. My diet wasn't that great. I probably drank too much beer and whatnot, but it was just always there. It was always something that was in the background. It wasn't horrible enough to necessarily seek out medical advice other than like have a Pepsid before you eat and you're in your bed and you'll be fine, which generally was the case. But it is one of those things that is an annoyance and you think about and it's on your mind, and you can wreck your night because you can't sleep because you got all your acid reflux going on. But yeah, that was another thing, like just learning how to eat better and understanding and fixing the gut. And who knows, maybe some of these gut problems really go far back. Like we've talked before, what has triggered your SIBO? And I think about all of the times that I've had food poisoning because I've lived abroad, I've traveled a lot. I've had it probably at least a half a dozen times, if not more. And so, how long were some of these maybe small issues that just bubbled up when I got the melanoma? That's something that strikes me as a possibility there that could have occurred. But what else was happening because my gut wasn't right? That wasn't necessarily apparent, that reared its head really badly during the past 2 years. What else can be fixed? And I think about like joint pain, again, the thing that I did have even before my gut got super bad. It just got way worse with the SIBO. And now, as it's starting to get better, I'm like, okay, I wonder if I can start building up some more strength than what I even had before, because it seems like that's a possibility now, like true improvement, as opposed to, well, if I can just get back to baseline or somewhere near baseline. But now I feel like I really have this understanding that diet and nutrition is like, this is part of your life. But it isn't just about being healthy. It's about this, how do you want to live well? It means so much more than just not being sick.
Yeah, absolutely. Doing the things you want to do. And you brought up a really great point because I'm sure listeners are wondering, how do you get SIBO in the first place? And just like you described, it's because I talk to a lot of people and hear their timelines and about this, and it can be just like one thing that triggers it, but usually there are layers to it. Usually it kind of brews over time. Definitely the most common cause is food poisoning. And food poisoning, once you have it, you can be more susceptible to getting it again. And that slows down your small intestine's ability to clear itself, which is how the bacterial overgrowth builds up. And then I think also stressors, so physical, emotional, mental stressors. So when you got the melanoma, that could have just been a stress to your system that pushed you over the edge, where now your system just can't keep up and deal with it. So it usually is something like that. Usually people will tell me, yeah, there's a moment they noticed it getting worse, but it's not like things were perfect before that. It was a progressive thing. But like you said, if you're just having to take antacid here and there, that's not exactly something you worry too much about or feel like you need to intervene or overhaul your eating habits or anything for. So for people who might be listening and wondering if hydrogen sulfide SIBO could be part of what's behind their symptoms, and maybe I should go over what the symptoms are so people can try to piece together if this applies to them or not. So hydrogen sulfide SIBO, it's unique. We see a lot of the symptoms that we see with typical SIBO, which are the standard kind of IBS symptoms. And it actually can be diarrhea or constipation. It depends on where the hydrogen sulfide producing bacteria are located in the digestive tract, but we can see it go either way. A lot of people think it's just diarrhea, but we do sometimes see constipation. Bloating is one of those hallmark symptoms of SIBO, abdominal pain. We tend to see, in general, people with hydrogen sulfide SIBO, they're more miserable overall. We see symptoms more so all over the body. So with all SIBO, we can see brain fog, we can see fatigue. But in general, and this is just a clinical observation, hydrogen sulfide SIBO tends to make people more miserable because sulfur in those levels really is toxic. So you can feel very sick with it. One clue, if you're curious, would be take 2 weeks and go on a low sulfur diet. See if that helps. Maybe take some over the counter Pepto-Bismol, because bismuth is an agent that can help kill hydrogen sulfide producing bacteria. Just as a trial, I'm recommending like take a finite period of time, a week or two, and see if you notice any improvement. And then if you do, I don't recommend like staying on that. I recommend going and getting tested to confirm. Some of the other symptoms we see with hydrogen sulfide, and I think I remember going down this list with you, Doug, because we were trying to piece the puzzle together when we saw that flat line on the breath test. Tingling in the extremities or numbness in the hands and feet. And you don't have to have all of these, but if some of these are ringing bells, that would be a clue. Sometimes we see bladder issues or frequent UTIs or bladder urgency, body pain, like in the muscles and tendons and joints. Now, clinically, you'll see on the list intolerance to light and noise. I can't say I've ever had a patient report that, but that's often on the list when you look up these symptoms. Another clue could be if you feel worse after you use Epsom salts, because Epsom salts are high in sulfur and they get into your blood through the skin. So that would be a clue as well. And then, yeah, just feeling toxic. A lot of people just describe feeling toxic. So those are the symptoms. If any of those are ringing a bell, like I said, you might try a low sulfur diet. You might try taking some Pepto-Bismol and see if you notice any difference. And then I would pursue testing. Testing can be available. A lot of, like I said, a lot of the gastroenterologists these days are ordering the Trio Smart test, which tests directly for hydrogen sulfide. So that'd probably be my recommendation. We also can order the testing in our practice as well if you decide to work with us. And then would you have any advice, though, Doug, from the patient perspective, just as far as you had to advocate for yourself because you ran into a dead end with the standard medical visits? So, what would you tell somebody who feels like this is going on or who feels like discouraged, like how you have felt a few points along the way?
Yeah, I think a lot of it is just doing your own research so that you start to get your mind around what the heck is happening and really look for those folks who are saying the right things and understanding SIBO. When I first started talking to some of the practitioners that I was working with, it was like, it's IBS. And again, SIBO was mentioned like once and in passing, like, but hardly anyone gets that. It's not even worth testing, you know? But then when you start to do more research, you see SIBO comes up a lot, especially you go into different Reddit forums or you check out YouTube videos and it starts to come up more and people talk about brain gut access. And I started following different kinds of blogs and reading through different things and doing that kind of research so that you know that there are more options than just IBS. There's a whole big gambit of different things that it could possibly be. And then like I really can't advocate enough to just maybe start with a good dietitian, but look for one that really understands this. Like for me, you know, living in Minnesota, I was looking locally and mostly what I found were dietitians related to, you've got the diabetes and diagnosis, or maybe you've had some heart issues, or you're just trying to lose weight, or maybe sports performance kind of stuff. But finding a dietitian or nutritionist that really specializes in gut issues and can get really deep into this because it is so ridiculously complex. I understand why a generalist might not know this because like the depth that we went into with the testing and understanding what's happening here, it's a lot. It's a really overwhelming amount to go over. So getting a partner who can help you through that process and understand that I think is really huge. And then just not giving up. Just keep going after things and trusting your body. You had mentioned with the hydrogen SIBO, just that overall body pain and feeling toxic. And I still see an acupuncturist for some of my wrist issues. But as we were talking about IBS, we were doing some like vagus nerve stimulation and different things like that to work on that brain gut access. And I found myself getting more aware of my body. And that's when I really started noticing the connection between when my gut's bad, my joints feel bad, and looking for those connections like, what else is happening when my gut is bad? My gut's bad and I'm feeling really fatigued and I feel like I'm just not as quick today. And I can't really say as I had any sensitivity to light, but I do remember days where you're just so miserable that you're sensitive to everything. It's like, I just feel awful today, like in every sense of the word. I'm headachy, my body hurts, my gut is destroying me. Like, full on misery. It's more than just like I ate something bad. Like obviously something else is going wrong systematically to have these cascade effects. And it's like, look at that and pay attention to it. And it's not like 27 separate issues. It's one really big, serious issue that's really complex, which not to discount the fact that I've got some stuff. I've got the tendonitis and other things that are going to cause some of that body ache and pain. But when you remove that factor of the SIBO, it's night and day. It's a different kind of pain. It's a different kind of injury that I feel systemically. And it's very meaningful to start to unwind all of that.
Yeah, absolutely. And I think, I'm not sure if I slipped up on my words earlier, but if I said sulfur is toxic, I meant the hydrogen sulfide gas is toxic at high levels. Low levels are okay and actually beneficial, but at high levels, it's absolutely toxic. And that's why it feels so awful. So Well, I'm just so pleased that you shared the story from the patient's perspective of what it's been like to go through this. Hopefully, anyone listening who's feeling this way now has some hope and some next steps that they can explore. If you're listening and you feel like you're up against a dead end, well, you're not. There are trained professionals who can help you with this. And yeah, I would agree. Always keep looking for answers. A lot of times we hear these things discounted. And just keep in mind, just because a practitioner's never heard of it before doesn't mean it's not real. There's information out there. Thankfully, today there's a lot of information on the internet, almost to our detriment, right? Because it makes it really confusing to try to figure it out on your own. So don't try to figure it out on your own, but do enough research that you can be armed with good questions and find somebody that fits what you're dealing with. Yeah, there's lots of specialists out there in all different areas. And yeah, as when it comes to digestive symptoms, functional nutritionists or functional medicine providers, I would say go beyond just functional nutrition and functional medicine because I've been actually surprised to notice. So I'll have patients coming into our practice who they've been to functional medicine already and they still weren't getting, whether it's hydrogen sulfide or other gut issues, other IBS type issues, they still haven't figured it out because those functional practitioners were not specializing in GI. So I would say look for someone like our practice or a different functional medicine or functional nutrition practice who specialize in digestive health. That would be my recommendation. So, well, thank you so much, Doug, for being with us today.
My pleasure.